Local multidisciplinary teams are now able to request genetic testing for patients with a new cancer diagnosis without referring patients to the regional genomics centre. It is recommended that assessment of eligibility takes place in the diagnostic MDT meeting to ensure results are available in time to inform treatment decision making. Eligible patients with breast cancer will be tested for errors in the BRCA1, BRCA2 and PALB2 genes, and the referring clinician will receive the results directly from the regional genomics laboratory hub within 6 weeks. If a patient is found to have a gene error, the local breast team should then refer the patient to the regional genomics centre for support, counselling and discussion of management options. This video has been made to support non-genetic specialists as they prepare to speak to patients about genetic testing. We will now see a simulated conversation between a patient and a specialist nurse who is consenting the patient for genetic testing.
Hi, my name's Harriet McMillan. I'm one of the specialist nurses with the breast team. How have you been feeling this week?
Okay, a bit nervous obviously. I just want to get on with the treatment now really.
Yeah, I'm really pleased you're ready to proceed with treatment. But do you know why we're here today?
It's something to do with genetics or something, is it?
Yes, that's right. Yeah. So we want to offer you the option of genetic testing to see if your diagnosis was caused by an error in one of your genes. So I've got an information leaflet here that we're going to go through together today, if that's okay.
Okay.
So we're offering you the option of testing because of the specific type of cancer that you've been diagnosed with, or because of the types of cancer that have been diagnosed in your family. And the specific type of cancer increases the chance that it may have been caused by an error in either the BRCA1, BRCA2 or PALB2 genes in you. So we offer this test when there's at least a 10% chance that we will find an error in one of these genes.
And what will those results mean for me?
So there's 3 possible results from genetic testing. The first is that we do find an error in one of your copies of these genes. And that would most likely be the reason for why you've developed your cancer diagnosis. We sometimes call this a positive test result, and this result would also have implications on the type of treatment plan that we're going to put in place. The second type of result is that we don't find any errors in your copies of the genes. So we sometimes call this a negative test result. So although we will not have found the reason for why you've developed your cancer diagnosis, it is reassuring that it's unlikely to be due to one of these high-risk breast cancer genes. The third type of result is that sometimes we can find a change that we've not seen before. So that means it's quite hard for us to understand if that's actually caused the diagnosis in you or not. We call this a variant of uncertain significance or unknown significance, or a VUS for short. So with a VUS result, that wouldn't change any treatment plans and it wouldn't change anything for other people in your family either.
What about my family? Do I need to tell them that I'm having these tests, or what do I need to do?
So it's a really good question. It's very much up to you at this stage. Sometimes it is helpful to tell other people who are close to you in the family just while you're waiting for the result, just as a source of support at the moment. But if we did find an error in one of your copies of these genes, then we'd refer you on to the specialist genetics clinic. And they'd be able to go over things in more detail with you about what that means for you, but also for other people in the family, and they would be able to help you with information and ways of sharing that information with the family. Okay. So based on the information that we've gone over today, are you happy to sign the consent form with me?
Yeah, I think so. I think it would really help me to know.
Great, okay, so there's just a few statements here that we'll go through specifically, and then I'll ask for your signature and then we'll be finished.